yeast. So we talked about symptoms and signs and how to not mistake, your own discharge for yeast. And now we talked briefly about probiotics. That would be a big treatment. Prevention. It wouldn't help to get rid of it, however. And the more common treatments are fluconazole or Canesten over the counter. What's interesting is that I found over the years that just like antibiotics are developing, or bacteria are developing resistant to the various antibiotics, so are yeast.
Tanya, have you ever had a yeast infection?
I have only had one bladder infection in my life, but I've had, unfortunately, tons of yeast infections. As a lifeguard, walking around in a wet bathing suit all the time, had to figure it out the hard way.
Wow.
And I was a kid, 16 years old, probably until 21. It was on and off until I had to figure out that maybe if I jumped in to, rescue somebody who didn't know how to swim off the diving board, they're jumping in, and I would bring them out and then, change my bathing suit, wear a dry one. So I had multiple bathing suits. I figured that out because sitting around in moist, wet clothes aggravates and feeds yeast. A lot of my patients over the years figured out the hard way as well with yoga, because with hot yoga, they might be sweating and then, or exercise in general, and then walk around all day with that and not have a shower and change clothes. So highly recommend changing your clothes at the very least and showering after yoga, and changing your bathing suit if you're a lifeguard.
And then, of course,
to a dry one.
When you're menstruating as well, some people are prone to it, premenstrually and menstrually, because, again, there's definitely more moisture down there and it's natural. So we have to offset it.
Yeah, yeast likes dark and sweaty environments. So it can even grow underneath your breasts if you happen to be heavier chested, and then under your arms. So if you're having, a systemic kind of yeast overload, it can come out in your skin as rashes in those areas as well. So the symptoms usually for a yeast infection, I don't know, Mary, you asked me if I've had, but for me, it was, if you want to get graphic, I felt like I wanted to stick a fork up there and scratch it. I remember saying as a kid, which is really rude, but it was so itchy. And then it was burning if you tried to itch it. Not that I ever tried that. But, it was just that level of intensity. But my body does, even like everything's intense for my body. I guess it's my intense personality. I don't know. Bladder infection the one I had in my life went from 0 to bleed right away.
Oh, my goodness.
And intense. Yeah. So, right. and yeast infections were always very obvious. How do you know you have one? The itching, the burning, the irritation. And sometimes it's a discharge, a change in discharge. So a lot of people think they have yeast infections because they don't know that it's normal to have a little bit of shift in cervical discharge. So in the beginning of the menstrual cycle, are you okay to go through this, or do you want to talk about how you experience the yeast infection first before we jump in?
We'll do both, right?
Sure.
Because there's regular cervical discharge that we need to identify that goes throughout the cycle, and it changes. Yeah. So why don't we go through how it looks like during different phases of the cycle?
So generally, if you are fertile and menstruating, you would have a bleed first. And unless you're ovulating while menstruating, you're not going to have that goopy cervical mucus. We call it EWCM, which stands for egg white cervical mucus. And that usually shows up later as the cycle progresses and your estrogen's on the rise. You're going to have, you're going to go from menstrual blood to perhaps a more lotiony discharge. You might see it on your underwear. You might not see anything. And then as the cycle progresses, you see the clear, goopy, kind of, you can like take it between your thumb and your pointy finger, and you can actually see that it stretches the egg white cervical mucus if you're actually checking it. And or you might just feel a slippery white when it's at its peak. And that usually takes up to 5 days to get that peak level of discharge. And then from there, it goes back to lotiony right around ovulation. And then it kind of stays there. That creamy, lotiony white discharge may be confused with yeast discharge. It becomes more obvious if it's like it looks like a cottage cheese and if it's excessive.
Yes, cottagey, cheesy. It could be whitish, but more often it can go towards yellow. And then again, it may have a smell. right?
Yeah. So I sadly at 21 also experienced bacterial vaginosis, which is distinctly different from yeast infections. Never, and I have like a nose like a dog, so I never noticed an odor with yeast infections, but bacterial vaginosis definitely is spot on with that whole fishy amine kind of release. Like they say that there's an odor with bacterial vaginosis and it smells like popcorn. So I remember
Oh,
working I remember working in a pharmacy and going, what's that smell? And it was coming up my shirt. So now I'm being like totally,
wow.
open and
Yes.
honest, but it was such
Yes.
a hard condition to treat because I guess I had resistant bacteria. And finally, I realized after doing a ton of research that the best way to treat bacterial vaginosis is we're talking about infections. We don't have to limit to yeast. But I figured out that the local diflucan worked better than the oral stuff, which is pretty intense. So, making sure also to change my nutrition and take probiotics and all that kind of stuff. So I saw a naturopathic doctor at the time. But it was very stubborn and definitely odorous. And yeast, I don't know. I find patients don't say there's an odor, but a definite like it looks different. The discharge
The
and
itchy.
it itches.
Yeah, like crazy. It's like
There's
a
not
son
much
of a
of an
bee.
itch with bacterial vaginosis. You can walk around not knowing you have it. Your partner might be the one to say, "Oh, there's an odor," if they're, kind to tell you and they're not afraid or whatever.
So I love it that you're being so open and honest and transparent. So I will, it's like we're having this anonymous meeting and we're telling everybody our stuff. I've had BV as well.
Okay, there you go. Like I think it helps for people to know that it's like, it's even STDs, not that, whatever. Like I think that it's important for people to know that they can happen, right?
Yes.
And that it's not, it's just, these are viruses
There's
and
no
bacteria.
shame.
And no, there's no shame. And
None.
we're full of viruses and bacteria. Some happen to be sexually transmitted. BV isn't. But it's a bacteria. They're sneaky little guys.
They are
COVID was a virus. Like
yes.
we're like everywhere. There are viruses and bacteria. And so it's just managing our immune system, not just treating and killing, but it's good to know and not have shame.
Yeah. And I love it that you said, you did the research and you figured it out for yourself. Well, I didn't know that I had BV until I was actually in the thick of trying to conceive. So a lot of times, the juncture of time that people will find out because they're doing more testing when they're trying to conceive and they've been having challenges.
Yes.
So if you are trying to conceive, I would totally check out to see if there's BV because there's some evidence to say that it might lower the chances of conceptions. But I don't.
It might increase the chance. Like I remember when I was studying it for the book that I was writing a chapter for, and like a increased risk of implantation failure or miscarriages or whatever. So
yes, and that's another episode for sure because we're going to speak to this. People have been asking me a lot about how about bacteria in the uterus and cervix? Like, can that impact? And there are tests for that, but we're going to, speak to that in another episode for sure. So we're going to go back to the yeast infection and BV, I guess, right? And so it's prevalent. It happens and there's no shame in it. And there are things that you can do about it.
Yes. So we talked about symptoms and signs and how to not mistake, your own discharge for yeast. And now we talked briefly about probiotics. That would be a big treatment. Prevention. It wouldn't help to get rid of it, however. And the more common treatments are fluconazole or canestin over the counter. What's interesting is that I found over the years that just like antibiotics are developing, or bacteria are developing resistant to the various antibiotics, so are yeast. What's fascinating, I'm not like a big proponent of sharing, brands or anything, but I think this is really important because a lot of people will think they just have, resistant yeast because they've been doing canestin or fluconazole prescribed by their doctor. But there's a couple strains of Candida that are resistant to fluconazole now. The C. Candida glabrata and Candida krusei, which the miconazole or monostat, if you want to get a branded one, you can probably get a prescription for miconazole. I haven't actually tried. But seems to kill the recurring yeast that seems to come back with the menstrual cycles. Women will often get it with that change in estrogen just before the menstrual cycle, and they'll take an antifungal. It will seem to go away. They'll get their period and they'll come back the next cycle. So, sometimes it's just getting the right antifungal, because some of the azoles they're resistant to that particular strain of yeast that they have. Obviously, putting up a good fight, with good bacteria too, like introducing good bacteria can help, so that your own bacteria can kind of outweigh that yeast is important. So not just choosing the right antifungal, and then on top of that, supporting your immune system. So I remember reading that, food has no bearing on yeast infections. It doesn't matter how much sugar you're going to use. It's not like sugar feeds yeast. Well, what I think it does, even if it doesn't quote unquote feed yeast, is that it suppresses your immune system. Like it impacts your immune system. So eating healthier whole foods, making sure you have enough protein in your diet to feel full, eating fruits and vegetables so that your skin can heal and the irritation can heal with the vitamin C in the fruits and vegetables. Like all that kind of thing is important so that your body can do the work to fight and your white blood cells can mount a response.
So this is a really interesting thing that you're saying, because in the past, what I have known to be true is that when you have a yeast infection, it's like cut out all sugars, which includes fruit sugars. Do you subscribe to that, or are you saying that's a little too extreme? I would love to hear your thoughts.
So I think it's a bit extreme, and I used to do that, but I feel like then women would get a little bit stressed, because now like their physical body is stressed because they're perhaps losing weight when they don't need to. If there's somebody who needs to lose weight, it's probably okay. But if you've got a slim woman who doesn't need to lose weight and you're saying, okay, I need you off all sugar, which is fine, but then plus fruit sugars, they might end up craving other sugar and then succumbing to that. Or maybe they're really strict and diligent and they avoid it, and then their body physically is stressed and then they catch a cold. So I think it's really important just to eat a whole foods diet, feed your body with good nutrition, and then take probiotics, make sure you're getting enough resistant starches, so that you've got good prebiotics to feed that good bacteria so that it can outweigh the yeast. And then keep strong and solid. Regular meals are important. If you're somebody, who has type 2 diabetes, then in that case, it would actually be helpful to cut the fruit, because your sugars being higher in your bloodstream, so your glycated hemoglobin may be high, meaning like your sugar is bound to your red blood cell center. That sugary blood is going to impact the yeast infections, and it weakens your immune system. So cutting fruits out in that circumstance may be helpful, and even intermittent fasting and improving your insulin sensitivity, you'll get less yeast infections. And I always find it interesting that the body's so cool. When you have type 2 diabetes, you will pee out sugars in a way to get rid of your sugar, because your body's like, okay, got too much sugar, can't manage it with insulin, so I'm going to pee it out. So you're also more prone to, because of this high sugar, immune system weakness, bladder infections and yeast infections. And in a previous episode, we talked about bladder infection. So go back to that episode.
Through myfertology.com. And just so you guys know, fun fact, in Chinese, we say diabetes, the literal words that we use is tong liu bing, which means sugar in urine disease.
Oh,
that's literally how we say it. Yeah.
Oh, so fascinating. Yeah.
Yeah.
One of the first symptoms might be getting up all night to go pee, right?
Yeah, right. And so you've provided the Western perspective. So to provide an Eastern viewpoint on yeast infection, we actually call it damp heat in the lower jiao. So in the nether regions, obviously, is the lower area of the body. And it's damp and it's hot. And it kind of really is just, we're, again, speaking more in the way of functionality, what's happening. It is like dampness, and that's where bacteria and yeast grows, in that darkness and dampness. So again, the name is, damp heat in the lower jiao, which is in the area of the lower body. There's dampness and there's heat. So how do we counter that? We take herbal medicine that will counter this heat and toxin and inflammation, which is what we'll allude to in the West, right? Because again, this medicine is thousands of years old. So there was no languaging around the Western terminologies that we have now, but it makes sense from a practical point of view. And so there are herbs that are more drying, and that will naturally be more anti-inflammation. And we call it, that's cut the fire toxins in the body, and how it will help to decrease the dampness in the body, and how to support, like, so in terms of functional strategies, it's like we support the organ systems that will be the culprits. So we want to support the liver, we want to support the spleen and stomach. And does that make sense to you?
Yeah, 100%. So it's very tied in with, having a stronger immune system and keeping the dampness down. I was just in my mind, I had a question for you because, a lot of patients will say, so should I take dairy out? So because it's considered in Chinese medicine, it's damp. What's your answer to that?
That's a really great question. And I always go back to, we need to look at an individual as an individual.
Absolutely.
And so, most of the Asian population, if they're, well, at least Chinese, Asian, or Japanese, like, we don't really typically have dairy in our diets naturally, but we live in the West where we incorporate it. So in those instances, I would say, yeah, it's probably not the best for your body, because it's not like we've had generations of ability to support and digest it. And in truth, I mean, most people as an adult, we don't digest dairy as well as we do as when we were children, right? But if you come from a cultural background that, like, it's a staple, like the yogurts and the dairy is a staple, and your body really does well with it, I'm not going to cut it out. I'll say maybe, and if you want to cut out, then maybe cut out the heavier fatty ones, right? So like the milk, maybe you don't need, but like you could still do the yogurts, and maybe just during the time that you have active yeast infection, you'll have less. But then, right? What are your?
Yeah, you could argue. Well, yogurt has probiotics, and I agree. If a person doesn't have a personal sensitivity and they don't bloat or get diarrhea or digestive problems from consuming yogurt, plain yogurt, I might add, not the, I hate to use the brand name, but Activia, where there's sugar added. They market it as a probiotic, but then you're now adding sugars where you can get maybe that sugar from natural sugars like fruit. So cutting out added sugars and a plain yogurt and cheese in small quantities. I would definitely not be guzzling and drinking milk, because again, the lactose is sugar, or you're having a lactose-free kind, which they add sugar to make it sweet. So
they do. Okay. Yeah. See, so you have to always buyer beware, right? Just anyway.
Even in cream products, they'll add sugar to many of the creams, which is totally unnecessary. So considering dampness, buyer beware. Dairy is totally fine if you're fine with it. But if you get eczema from dairy, that's a definite no if you have a yeast infection, because it might, the damaged area, like let's say you have a yeast infection, eczema in the genital region, that could create a yeast infection or aggravate one because the tissue is already damaged. And then other times that you might be more prone to yeast infections, as we talked in a previous episode about bladder infections, would be during hormonal changes. So when you're pregnant, when you're perimenopausal and they're swinging roller coastering hormones, big changes in estrogen, and or when you don't have the estrogen, when you are postmenopausal and there's that adaptation or shift to this new low of estrogen. So if you're somebody who's really suffering, you can use estrogen to help bring up the tissue and the plumpness of the epithelium so that it's less irritated. Let's say if you want to maintain intimacy, and it's really important to use lubricants, because if you use a natural lubricant, it's more pleasurable, and then your own body will produce lubrication. You get less irritation. So a lot of women, I think, say, oh, absolutely, why would I need a lubrication? I've got lots of lubrication. And so it depends on how busy you are as a person and as a couple. If you start to get to this place where you're kind of just skipping out on the lubrication, but then you've got irritated tissue, that can create a nice environment for yeast and bladder infections. So using just a little bit of lubrication at the beginning of any intimacy session can enhance your communication, the feelings, and then prevent damaged tissue. So my favorite would be like a silicone or a water-based lubrication.
That's great. So sometimes sexual intercourse can increase yeast infections. But, people that take antibiotics and, having done listen, the only time I've ever taken antibiotics in my life was doing my IVF cycles. It was part of their protocol.
Wow.
That was the only
you
time
are solid, girl.
What's that
That's
mean?
the only time? Like,
Yeah.
are you blood type O? Like, no infections ever? A, interesting.
Yeah, but
totally not relevant then.
I don't know. That
Mm.
doesn't necessarily mean I've never had infections. Probably it's just like that my
But your body just
personality
fought
and fought it or whatever.
That's
amazing.
Right?
But, I was the person that would never get sick. Literally.
Wow.
And the only time I got sick was the 5 times I used antibiotics in my life for IVF cycles. And
That's
that
amazing.
was, and it can trip up and make things, the dysbiosis in the body. So you can get increased risk of yeast infection during that time, just to be aware. And they're uncomfortable, like you're already going through fertility or you're pregnant, and it's like it all just sucks.
Yes. Yeah. And is it safe to treat when pregnant? Absolutely. You can use local treatment. You're not going to hurt your baby. There's like a little, plug between the vaginal area and the uterus. So you can use antifungals safely. Speak to your doctor about it, obviously, before jumping in. And you can even test over the counter. So over the counter at the pharmacy, you can get these little swabs if you can't get to the doctor, as a stepping stone to getting to the doctor, where you can test for yeast and bacterial vaginosis. And there's these little boxes, or you can get them online, just like you can check bladder for bladder infections at home.
So, that's amazing tips, because I never knew this. I would have not known that. So any pharmacy then? So
pharmacies for sure. Yeah. Not for the bladder infections, although they should, because now pharmacists in Ontario can prescribe antibiotics. So might as well have the strips, the dipsticks, so that you can then confirm it and then get treatment if you're going to go that route, because of the clogged up system in Ontario, or just to have that easy access, right? It would be nice. But I know that you can order them online. I mean, I use it for patients. Yeah.
So just before we sign off, natural versus canesten and monostat, what do you say to people? Because it's like, I want to just do all things natural.
So I usually say in this scenario, start with an azole family. And if that's not effective, then with azole family, meaning like a canesten or a monostat, then you could try boric acid. Usually it's for resistant cases, but it's not always effective either. So probably you'd have a better outcome with starting with the azole antifungals, although that's not quote unquote natural. They're all chemicals, right? Boric acid's a chemical, antifungals like azoles are chemicals, we're chemical. So,
right.
I just think that what's important is it's effective and you're not walking around and, hurting yourself by suffering. So, make the changes after for the preventative part with natural, and then do the initial treatment, just like a bladder infection.
Yeah.
Treat it.
I think that's a great point. And typically when people see me for TCM, like whether acupuncture or herbal medicine, they've already had many yeast infections. It's like, I've done this and it works in the moment and then it comes back. So when we treat them, we've certainly seen some very effective results using the acupuncture and Chinese herbal medicine to, as I mentioned, to take away that damp heat in the lower burner, in that lower area of the body. And so that it actually stays away, not just treating in the moment. Because it's about, as you say, being proactive, making the immune stronger and having the balance be there more permanently with regards to the bacteria and yeast that are naturally there to begin with, right? So you just don't want overgrowth of anything.
Right. If patients are also experiencing kind of systemic symptoms of candida, which you can read on the internet, sometimes patients will think that they have itchy ears or itchy anus or digestion, discomfort, dysbiosis, like you call it, or gas that's really smelly. In addition to recurring yeast infections, working on systemic treatment is a good idea too. Just oral natural antifungals like berberine can be very effective, which comes from golden seal or berberis, the herbs, and then probiotics like oral, not just local, which again, if you do antifungals locally, meaning insert them vaginally, you can also finish that with vaginal probiotics to reset the microbiome local, and then take oral probiotics. But you would definitely want to look at nutrition and stress, because, if you're kind of your whole system's off, it's not just about what are you eating and, what are you avoiding and what chemicals are you putting on your skin and all that we've mentioned before. But, look at kind of slowing down your life, which we should talk in a future episode about, perimenopausal years. How do we slow down? Because that can really weaken the immune system, and acupuncture is really helpful for that, because you're treating the liver and all the pathways that are going to support the immune system. And it helps you slow down. You are literally pinned to the table. No, you're not. I'm just kidding. Sorry. It
No,
feels
that's
so
okay.
relaxing.
That's
And the
okay.
number of times I've had patients just say they like the one opportunity they just feel connected. Different than massage, but another route that you can use as well. And obviously exercise, but making sure that you're changing your clothes.
So if you guys love this episode, you have to check out our future episodes and our past ones. Go through myfertology.com, and in fact, just subscribe to our podcast, our YouTube channel, because the more people we get eyes and ears on this, the more we can help others. And that's what we're here for. We love to help you guys. Reach out to us.